Good morning. Welcome to the Joint Health and Pandemic and Disaster Preparedness hearing. Thank you very much to Health and Human Services Chair Yamani for helping us to schedule this. It's Thursday, March 18th, 11:30, and we have 3 bills up on the agenda. First is Senate Bill 970 ST2 relating to telehealth. And we have testimony from Alani Kioki, DCCA PVL, Hawaii Medical Board.
Good morning, chairs, vice chairs, members of the committee. Alani Kioki, Executive Officer of the Hawaii Medical Board. The board will stand on its written testimony in support of this measure. Thank you.
Thank you. Next, we have testimony from Kaiser Permanente. Jonathan Chang.
Good afternoon, chairs. Jonathan Ching for Kaiser Permanente. We will also stand in strong support of this bill on our testimony and available for any questions.
Thank you. Next, Michael Robinson, Hawaii Pacific Health. Not present. And then finally, late testimony, Healthcare Association of Hawaii. Paige Heckathorn Choi.
Hi, good morning, Chair. Thank you so much for accepting our late testimony. I apologize. I think it was about 10 minutes late. We'll stand on strong support in our testimony. This is a priority bill for the Healthcare Association of Hawaii and our members, and it does have wide industry consensus among our partners. And so we do appreciate you hearing this bill and hope you will support it. Thank you.
Thank you, Ms. Choi. That's all the testimony that we have. PDP members, any questions? Seeing none, I'll turn it over to Chair Yamane.
Any questions, members? Representative Ward.
Chair, to I think Mr. Chang of Kaiser. Do you have any numbers on your pre and post COVID telehealth utilization? Any estimates that Kaiser or for the industry in general?
Yeah, Chair. So Jonathan Ching for Kaiser. Yes, as noted in our testimony, we've seen a dramatic increase in the use of telehealth, especially with the waivers that the governor provided during the pandemic. Just based alone on video visits, we had approximately about 1,000 outpatient video visits in 2019, and in 2020 during the pandemic, we saw that drastically increase to 67,000 video visits.
Wow, 1,000 to 67,000.
Yes.
Okay, a bill whose time has arrived. Very timely. Thank you. Thank you very much. Thank you, Chair.
Thanks,
Okay,
Chair.
any questions? Okay, seeing none. Chair, back to you.
Thank you. We're going to move on to SB 1156, Senate Draft 2, making an emergency appropriation to the Department of Health. We have nobody signed up to testify via Zoom, but we do have testimony in support. And moving finally to SB 192, SD1, relating to public assistance. We have testimony from Department of Human Services.
Scott Nakasone with Department of Human Services. The department stands on our written testimony providing comments and available for any questions. Thank you.
Thank you. Next, we have testimony. Actually, I'm sorry, Mr. Nakasone, you're listed twice. That's all the folks who signed up to testify via Zoom. PDP members, any questions? Yeah, I have a quick question for DHS. Mr. Nakasone, I was wondering if you folks had looked at this bill and whether or not this additional benefit could potentially disqualify somebody from receiving other types of benefits like SNAP or WIC or TANF.
Sure. Yeah, and I can speak specifically to SNAP. Yes, it would more than likely disqualify an individual as we're required to count any sources of income. And so this would not be excluded.
So it would count towards income calculations for other federal benefit programs.
Yeah, definitely for SNAP. I think like for programs like for TANF, we do have a little more flexibility there in terms of what is countable, what is not countable, and so that's something that we could have a discussion with our federal partners. But for SNAP, definitely it would be counted as income.
Thank you for that clarification. Turn it over to Chair Yamani.
Members, any questions? Okay, seeing none from HHH.
Okay, then we will recess for decision making. Recess. Good morning. We are reconvening the Joint Health and PDP Committee, our 11:30 agenda for the purposes of decision making on 3 bills.
Any people problem with that? Y'all good? Okay. So HD ones for all three.
Okay. So on Senate Bill 970 relating to telehealth, recommendation is to pass with amendments to defect the date to July 1, 2050. Members, any questions for PDP? Okay, seeing none, Vice Chair with amendments.
Chair's recommendation is to pass SB 970 SB2 with amendments. Chair and Vice Chair vote aye. Representative Cullen.
Aye.
Representative McKelvey.
Aye.
Representative Mizuno.
Aye.
Representative Wahlberger.
Aye.
Representative Woodson is excused. Representative Yamashita.
Aye.
Is technically the other one, can I take this vote?
Yeah, okay, as long as he says yes.
Representative Ward.
Aye.
Chair recommendation is adopted.
Thank you, members. Turn it over to the Health Committee.
Okay, HHH, same recommendation. Any discussion? Okay, seeing none, Vice Chair.
Voting on Senate Bill 970 ST2, Chair's recommendation is to pass with amendments. Chair, Vice Chair vote aye. Rep Gates. Aye. Rep Har.
Aye.
Rep Capella.
Aye.
Rep Lopresti is excused. Rep Nishimoto. Rep Ward.
Aye.
Chair recommendation is adopted.
Okay, thank you.
Thank you very much. Moving next to Senate Bill 1156 HSD2, making emergency appropriation to the Department of Health. Recommendation is to pass with amendments. We're going to add in some of the Department of Health emergency appropriation requests for contact tracing and epidemiological activities, public health PPE, Hansen's disease COVID prevention, public health nursing, temporary worker space, overtime, tests and administration, volunteer medical clearance requirements, and other COVID-related response. We're going to leave the amounts blank and put them into the committee report. We're also going to add that any federal reimbursements for appropriations in this act shall be credited to the general fund. Members, any questions? Okay, House Direct 1.
Chair's recommendation is to pass SB 1156 SD2 with
Oh,
amendments.
sorry, wait, technical amendments, sorry. Thank you, technical amendments.
Okay. Okay, Chair's recommendation is to pass SB 1156 SD2 with amendments. I have Representative Woodson excused. Any reservations? Any no's? Chair, your recommendation is adopted.
Thank you, members. Turn it over to the Health Committee.
Okay, so Health Committee, same recommendation. Any discussion? Seeing none, Vice Chair.
Vote on Senate Bill 1156 SD2. Chair recommendation is to pass with amendments. Noting the excused absence of Rep. LaPresi, who shall be excused for the rest of the agenda. Any reservations? Any no's? Chair recommendation is adopted.
Thank you.
Thank you. Finally, Senate Bill 192, Senate Draft 1 relating to public assistance. Chair is going to recommend that we pass it out with a House Draft 1, further defecting the date to July 1, 2060. I'd also like to insert a note into the committee report about whether this additional benefit might disqualify a recipient from other types of federal benefits with income requirements such as SNAP or TANF or WIC. Just to note that in the committee report for the next committee. Members, any questions? Okay, Vice Chair, House Draft 1.
Okay. Chair's recommendation is to pass SB 192 SD1 with amendments. I have Chair Representative Woodson excused. Any reservations? Any no's? Chair, your recommendation is adopted.
Thank you, members. Turn it over to the Health Committee.
Okay, members of the HHH Committee, any discussion, recommendations to move this as HD1? Okay, seeing none, Vice Chair.
Voting on Senate Bill 192 SD1. Chair's recommendation is passed with amendments. Any reservations? Any no's? Chair recommendation is adopted.
Thank you very much, Chair Yamane. We are adjourned.
Okay, yeah,